All right, the latest Medicare figures reveal a steep drop in bulk billing rates and more patients unable to afford gap fees. There are warnings that a new payroll tax as well could see gap fees rise a further $5 for a standard consultation at the doctors. Here to discuss the problems plaguing the Medicare system at the moment is Executive Director of the Primary Care Business Council, Jeremy Stones. Jeremy, thanks so much for your time this afternoon. Are you concerned about Medicare at the moment and how it's currently functioning?
Oh, I think we are, and most Australians that need to see a doctor would be. We know that there's waiting lists that are increasingly getting longer to see the doctor, and the cost of seeing the doctor, out-of-pocket costs, is going up. And as it stands, as of today, that trend is not going away. And certainly for the last many years, there's been shortages of doctors in rural areas, then in regional areas. What we are seeing now in Australia over the last 12 to 18 months is shortages of doctors really in the cities now. So in the outer metropolitan areas are now seeing significant waiting lists. So, reform needs to happen and things need to change.
I read in the Australian news article today that 40% of practices are running at a loss. Is that true?
That's absolutely true. That's absolutely true. And that figure of around 40% has really accelerated to that number in really the last 12 to 18 months. So it's been quite a rapid deterioration in the sustainability of the sector. And there are numerous reasons why that is. There's been some long-term issues that are gradually leading to this, and then a whole bunch of issues out of COVID have accelerated that. And those loss-making, that's regardless of whether a major company owns the clinic or whether it's a single doctor that owns the house in the corner. That average is right across the sector. And in regional areas, it's often a lot higher.
Okay, so the $750 million promised by the government to fix Medicare, is that going to be enough?
Well, it's $750 million over 3 years, so it's $250 million a year, and that's certainly welcome. $250 million is a significant amount of cash. In the overall health budget and costs, of course, it's not a lot. The government themselves, the minister, even he has said that in future budgets more will be required. So it's a welcoming start, of course, depending on how it is spent. But will it fix the problem of a shortage of doctors and out-of-pocket costs as they are? On its own, it will not fix that.
Okay, Jeremy Stones, appreciate your time and for joining us on Sky News to talk through it. Thank you.
Thanks, Kenny.